So my name is Aleks George Srbinoski. People usually just refer to me as Aleks George. I am a clinical psychologist, which means for me that I'm a therapist. So I work with people who are depressed, anxious, OCD, bipolar, all kinds of mental health issues, relationship issues. So that's one of my core skills and one of the core things I do as a clinical psychologist, is a therapist. I'm also a RTMS assessor, the lead assessor, a lead assessor for RTMS. RTMS is a type of brain stimulation that assists people to recover from very serious mental illness, such as depression, anxiety, trauma. So I have two core roles that I do as a clinical psychologist. One is therapy, which I predominantly work online these days as a therapist, and one is as a TMS assessor, assisting to make sure people are suitable for that kind of treatment, which is for people who are very seriously ill and are likely to benefit from that treatment. So the reason I became a psychologist is I think I had no choice in a sense. It was always sort of kind of destined in a way for me. So I've always had a deep fascination with people ever since I was a young boy. I was always wondering, why do people do what they do? Why do they do this? Why is that person sad? Why is that person happy? What's going on? And I always wanted to understand life and the meaning of life. And obviously, as part of that, it's also very rewarding to help other people understand what is the point of life, what is the meaning of life, because it's not just about obviously helping someone feel better, which is obviously the first step, but really what life is about is making the most out of it. So if you look at someone who's depressed, I mean, at the fundamental level, the reason a person's depressed is because they've lost a sense of empowered meaning about life. That's why they're depressed. Now, you could say there's biological issues and cultural issues, and that's all true. But at the end of the day, it comes back to a person has lost their belief in a sense of empowerment around life and what life is about. What does it mean? And you look at some of the people who are the most who've gone through hell in every single way, people who've gone through torture and war. And not everyone gets depressed, because there's a certain ability for certain people to have a mindset, a belief system that allows them to still capture life and have a zest for life. And of course, there's a classic example, which is probably the person that I was most inspired by as a younger person, which is someone called Viktor Frankl. He wrote a book called Man's Search for Meaning. He was someone who survived the concentration camps in World War II. And basically, his book was all about, you've got to find meaning in life, even when there's nothing around you that is worthwhile. And if you look at modern life right now, there's a lot of people really struggling to understand, what is the point of my life? What is the purpose? Where is the meaning? And so that's something I've always been fascinated in, both personally and obviously to see others also have meaning in their life. So although as a psychologist, there's all kinds of techniques and strategies to help people develop themselves, I often have lots of strategies where people can really rapidly learn how to improve themselves quite quickly. So like, one of my ideas is like, one of my personal websites is called 2 Minute Brain. It's all about how you can develop specific skills in just 2 minutes. So I understand the importance of having techniques and strategies, but at the end of the day, you have to go much deeper than that. You have to go much deeper than that and really get to the core of what is your life going to be about. And that's really sort of something that's always pulled me towards being a psychologist. Like I said, I didn't really have a choice in a way. I have lots of interests. I do lots of different things, but I think this was also one of those things where there was no choice. It's just who I am and what I was kind of destined. I think what's most rewarding about my job is that the work always matters. It always matters. So even on a tough day, even when someone loses their way, even when they relapse, even when they go through tragedy after tragedy, it always matters. And that's because the intent matters. The whole point of psychology, in terms of therapy psychology, is that you are there to help someone learn, grow, heal. And so the intent is always there. So even when something seems impossible, there's always healing that can occur. And that's really sort of what's rewarding for me, is that I know that it's super important. I'm not the kind of person that could look at spreadsheets all day. I'm not the kind of person that could do something if I didn't feel it really mattered in the right way. So that's what's most rewarding, is knowing that even on days where it's very, very difficult, it always matters. And on the flip side, when people make breakthroughs, when people improve, when people radically change their lives, it's just a fascinatingly fun, enjoyable, wonderful experience. So it's priceless. I mean, you can't you can't top that in any other way. I think what patients most value about me is I'm pretty easy to talk to. So I'm not someone that's stuffy in my demeanor. I'm not overly formal. I'm someone that really wants to understand a person wherever they're from, whoever they're from. So there's a deep curiosity within me to understand people and understand where they're from, what they're about, and it's my job to connect with them. So it doesn't matter your background, it doesn't matter your history. I'm always trying to connect. I'm always trying to find a way to connect. And I think a big part of that is also, although I'm dealing with very serious issues, there's a lot of laughter in my sessions usually, when I work with people like this. There has to be a balance between seriousness and playfulness. If it's just all seriousness, then it can become very stuffy, and people will start to become even more depressed in a way, or anxious. So there has to be the right balance. And of course, it can't just be all playfulness. That's not really going to work either, right? It has to be serious. So it's this ability to connect with people and really have a genuine desire to want to help. So I think that's what patients most value when working with me, is that I really try and aim to understand them. It's not about me, it's about them, and trying to connect with them where they're at and trying to help them through that.